Hello, I'm Lauren Puryear. I'm a genetic counselor at the University of Washington, and I work with a number of families who have children living with a rare disease. So I'm going to talk today about some of the tips and tricks that I have learned from them about supporting families of children who have a rare disease diagnosis. I have no financial disclosures. And I want to just start by saying thank you to the patients and families that I work with, because all of the wisdom I'm going to share with you today is really theirs. Here are the topics I'm going to try and touch on. I'd like to acknowledge some of the challenges that are faced by families with a child who has a rare disease. I'll talk a little bit about how we help patients navigate the healthcare system. I'd like to talk about some tips and tricks I've learned about dealing with community members, friends and family who are trying to be helpful to the patients and families we work with. And then I'll give you a couple of suggestions on where to start to look for support. So first of all, what are the challenges faced by families with rare diseases? If you're listening to this talk, you probably know most of these, probably even better than I do. But I just want to be upfront about some of the things that we know families are dealing with. So isolation is a major challenge. That feeling of we are the only people who are dealing with this, nobody knows what we're going through. There can be physical isolation for kids who have limitations on what kinds of activities they can do. There can also be social and emotional isolation for the family, especially in cases where children's limitations are not visible. Oftentimes the community doesn't really understand how difficult it is to deal with a rare disease when they don't see it on the outside. And so families feel like they're really very much alone in dealing with it. Another major challenge is that community members don't know how to help, or they try to impose help that's not actually what the family needs. I can't tell you how many patients complain about the advice they get from people who have no idea what their diagnosis entails, but are sure that the internet has come up with the right solution that they should share with our patients and families. Having a child diagnosed with a rare disease can be very, very difficult for parents, particularly when it's a genetic condition. Parents feel a lot of guilt about passing DNA on to their children, even though they have absolutely no control over what gets passed on. But this is really common. It's something that comes up over and over and over again in my conversations with parents. And they feel tremendous stress and guilt about everything that they do in trying to help take care of their child. I didn't work hard enough to overcome this limitation. I didn't seek the right specialist to deal with this kind of symptom. Parents feel like they should always be doing more, and they can't possibly do everything that they really want to do to support their child. And then, of course, children in the same families feel guilty that they have this diagnosis, even though, again, there's absolutely nothing they could have done to avoid it. But they know that there's a lot of attention and focus and stress in the family on them because of their diagnosis. And so it can be really, really difficult for all of the members of the family to navigate these feelings. And sometimes it's very hard to articulate them, especially for kids. They may act out, they may withdraw and kind of go internal, and they're not going to say, I feel really guilty. You're just going to see those other kinds of behaviors. So that's a big challenge for families. Another set of challenges comes around the healthcare system. So most primary care providers or family medicine providers, pediatricians, are not going to know that much about rare disease. And so parents often say to me, I know more about this than any of the doctors that we see outside of genetics or whatever specialist really does know about this condition. And that can be a really scary place to be for a parent without medical training, to feel like I have so many questions and all of the people I would want to ask aren't going to know the answers because I'm more familiar with this than they are. And then some families share with me that they see healthcare providers who think they know all about the diagnosis, but it becomes obvious to the families that the healthcare providers really don't know all about the diagnosis. And so that's a different kind of challenge to deal with, because people don't like to challenge their doctors. It can be a very difficult thing to do given the power dynamic in a lot of relationships with healthcare providers. And then finally, before I move on from this section, I just collected a number of questions that I have personally been asked. These are all real questions from real families. And you'll notice that a lot of them are not about medical management of a condition. A lot of them are about how do we talk about this and with whom? And at what stage do we tell our child different things about their diagnosis? And what can they do and what can't they do? And for most of these questions, there isn't a right answer and a wrong answer. There's sort of a balance between the child's needs and the parent's needs and the community resources available and the specific situation. And so a lot of what I do with parents in these kinds of situations is just kind of help them think through, what are my values? What do I think is going to be best? Because parents really do make the best decisions for their kids because they know the situation the best. So I can't tell you what you should talk to your child about at age 6 because lots of 6-year-olds are very different. All right, so I'd like to switch gears and talk about how do we support patients in navigating the healthcare system when they have a rare genetic diagnosis. And in general, for rare diseases, there really aren't evidence-based guidelines. Nobody has been able to gather a big group of patients and do a randomized controlled trial and a big study and figure out what exactly should we be doing? What's the best advice that we can give to everybody with this diagnosis? So patients end up being told different things by different healthcare providers because nobody has that definitive guidance to offer. And in a lot of cases, patients with rare disease end up being taken care of at sort of centers of expertise, often academic medical centers where somebody's doing research on the condition, and so they know more about it than anyone else, even if there isn't a lot known. And so I work in a clinic that is one of those centers of expertise, particularly for vascular EDS. I work with Dr. Peter Byers, who's been studying vascular EDS for decades. And so we see a lot of families for ongoing, sort of touching base once a year, figuring out how to help them get through their healthcare in their local community, because they're certainly not all living next door to us. People travel from quite a ways away sometimes to be able to get recommendations that they can then take back home to their healthcare team. So what do we do when we have a family with a child who has vascular EDS? We encourage families to set up a care team, and I'll describe more of what I mean by that. We urge them to make a plan for emergency situations. Who do they call first? Who's the first person that's going to help them triage what needs to happen? And then also have a plan for non-urgent questions so that they know kind of who are their point people for different kinds of medical situations before those situations actually happen. And then we also try to support providers who aren't familiar with EDS, but who may be seeing our patients to do the things that they actually already know a lot about. So we try to make Dr. Byers available to talk with any other provider on our patient's care team to give them a little bit of context and say, well, if you have this patient come in to see you and they have a bowel rupture, here's how it's the same as all the other patients that you take care of who have a bowel rupture. And here are some little things that might be different because of this diagnosis. So really empowering the providers and the patient's care team and their home community to be able to take good care of the patient, even if they don't know everything about the diagnosis. All right, so this is kind of how we conceive of care teams for patients. We think about the patient as the center. The patient is, really the most important thing that holds the care team together, and everything else should sort of revolve around what the patient needs. We also encourage people to find a really good primary care provider or some sort of coordinating medical provider who's close to home, who's their go-to person, who can kind of be in the center of that care team with them and can help advocate for them and take some of the burden off of parents and patients to have to do everything on their own to get around in the medical system. Our role is sort of to be a consulting specialty clinic. So when there's a question that comes up for genetics or for someone who's more familiar with this condition than the other specialists on the care team, we try to be available for that. Even if the patient is far away from us, we can be called and emailed, but we don't want to be the person who's coordinating everything because we don't have the capacity to do that. So we want to be able to be in touch with the patient and family, but also with their primary care provider if that person needs us. And then for vascular EDS, these are the other specialists that we recommend patients have on their care team. They should have a vascular surgeon in case they have an arterial dissection. They should have a general surgeon in case of something like a bowel rupture. And ideally, they would have sort of one face-to-face meeting with those providers in their community to set up a relationship and say, I have a greater likelihood of needing your services than people who don't have vascular EDS. If something happens, you know, how do I bring you in? How do I get to see you urgently if I need to? You know, what's our plan? Can my primary care provider call you if something happens? Whatever it is that you agree on, you want to establish those relationships if possible when it's not an emergency situation so that you actually know what to do when something happens. And then other specialists as needed, depending on what kind of symptoms the patient is having. There's nothing else that we say everyone with vascular EDS must have. And then ideally, all of these specialists are also able to talk with each other. We certainly make ourselves available to talk with other members of the care team if they have questions. But this really varies depending on the healthcare system that you're in, if all of your specialists are in the same system versus different, sometimes competing healthcare systems, that can be a problem. But ideally, the patient and the primary care provider have access to everyone on the team, and everyone else on the team is able to contact each other if they need to. So because of that ideal setup that we envision, the really important cornerstone of that is to find a great primary care provider or some coordinating healthcare provider who will listen to you and take your family's concerns seriously, who will be willing to learn a little bit about your diagnosis. They don't have to know everything. That's what the rest of the care team is for. But they have to just learn enough to be able to triage what's happening and figure out, oh, who do we need to loop in to help us solve this current situation? And then because of that, they need to be willing to reach out to others when they don't know the answer. So these are really the important attributes that we recommend people look for in their primary care person. And it's worth investing some time and effort into finding that person, because if they're in the center of that care team circle with you, with the family and the patient, they can help with some of the other outreach that needs to happen. You don't necessarily have to do that alone if you find a really good coordinating person. Before I move on from this section, I will acknowledge that it is not easy. It's easy for me to sit here and say, find a great primary care provider who will do everything that you need them to. And I know that that's difficult in a lot of communities. It's hard to find someone who takes your insurance, who will listen to you and take you seriously when they've never heard of this diagnosis before. All of those kinds of things are not as simple as it sounds to just go out and find someone who can do it. But as I said, it's worth investing some effort in trying to find that person, because ultimately that takes some of the burden off of the family to have to coordinate everything and triage everything themselves. All right, so I'm going to switch gears and talk a little bit about dealing with community and friends and family, and how do we support our patients and our families when they're trying to navigate helpers and people who want to be helpers but are not helpful in their communities. One of the things that comes up really often in conversation with families is, who do we tell? And when do we tell them? And how much information do we give them about this diagnosis? And the right answer varies tremendously from family to family. Some families are information sharers. They want their whole community to know. They start a nonprofit, they go out fundraising, they want the whole world to know that their child has this diagnosis and to get on board with helping them. Other families are much more private and they really don't want to go that route. And so they're trying to figure out who needs to know, in what situations is it important for people to know about my child's diagnosis. And so the things I encourage families to think about are, what are your child's daily interactions? Who are the people who are around them the most often, especially when parents are not there? And it can be useful to have somebody in that group, somebody who sees your child day to day, knowing about the diagnosis, especially if your child has limitations. For example, if you are trying to excuse them from certain PE activities, it's useful to have somebody at the school who's an ally who understands why that's happening, because then they can support your family and your child and make that happen. And then also thinking about, if an emergency were to occur, would there be somebody close to your child who would know enough to get help quickly? to know what kinds of things to look out for, what kinds of things to tell an emergency response team. So those are the things I encourage families to think about. And beyond that, it's really comfort level and relationships and who in your community do you want to be able to talk about this with. When you're thinking about educating people in the community, I would like to encourage patients and families to draw from their own experience. You know more about living with this diagnosis than any healthcare provider that you have. And your experience is really valuable as a tool to educate people about what it's like to live with the diagnosis. As an example, I talked with one patient who had felt for years like her sister didn't think her diagnosis of EDS was real and sort of picked at her and undermined her, until she finally sat down with her sister and said, here's what I go through. Here are all the accommodations that I make day to day to be able to go to the grocery store. Here are all the accommodations I make to be able to work my job, to be able to get there in the morning, get myself ready, to be able to be there for my whole 8-hour day. And really talking her sister through all of those things that she had to do to be able to participate in activities that her sister just took for granted. That was what opened the door and let them have a real conversation about the diagnosis where her sister was listening. So that personal experience, those stories are really powerful. And I encourage you to share those with people when you feel comfortable, and not assume that your experience doesn't count because it's not coming from a medical source. I also do recommend using information from a medical source if there's somebody in the community that you think that would be valuable for. Certainly I've had parents who take articles from a medical journal to school to say, hey, this is my child's diagnosis. Here are the things that we're thinking about. This is why I want you to take their limitations seriously. And then there are lots of information sources, such as the EDS Society, that have a variety of articles that aren't necessarily medical, but are sort of very carefully vetted and put together by people who know what they're talking about. So there are a lot of things out there that are written in plain English for people who don't have medical background to help them understand diagnoses. So those are all really good resources if you're trying to share information with somebody in your community, so that they know what your family is dealing with. I will also say that when people offer to help, it's great to take them up on it. It can be really useful to have specific options. So one mom of a child with an EDS diagnosis told me, I have a list. When people say, how can we help your family? You're navigating these medical appointments, you know, you're dealing with all of these things. What can we do? She says, here's my list. Here are things that are always helpful to us. If you volunteer to drive the other kids to soccer practice, that's always helpful. If you volunteer to bring us a meal, that's always helpful. So she had some really concrete suggestions, and then people could say, oh, great, let's put that on the calendar. I'll be driver for soccer this Saturday. It made it easy for people to help, and it made sure that what they did was actually useful to the family. I will also tell you it's okay to set boundaries. So if you have a neighbor who's offering to bring you meals and you know she's going to show up 4 nights a week if you let her, it's fine to say up front, you know, what would be really helpful to us is to have a meal on Friday nights, you know, 1 night a week of help so we don't have to cook. That would be great. The rest of the time we're going to be kind of doing our family thing, but we would really appreciate that. So it's totally fine to anticipate people wanting to overhelp and just sort of say, here's what would actually be helpful to us. People hear that fine if you say it nicely. I also want to give you permission to not have everyone in the world on your support team if it doesn't feel useful. So sometimes families get a new diagnosis and they feel like they have to say yes to every offer of help. And then it becomes really stressful, kind of juggling everybody else wanting to jump in and smother you with their love and their help. My story about this, particularly for that last bullet point, that it's okay to reset your expectations for a relationship and not consider that person part of your support team, comes from a mom whose child had a diagnosis of a rare genetic condition. And her own mother, grandma to the child, was desperate to be helpful grandma. And so every time they gave her something to do, she would do it not quite the way they wanted, or it wouldn't actually get done because she'd get distracted by doing something else she thought was helpful. It just became this burden on the family of trying to include grandma on the support team. And so finally the mom said, you know, the best thing I ever did for my stress level was to tell grandma, here, this is your project. This is what we'd really like help with, and gave her something that the family didn't care about at all. It didn't matter if it got done on time. It didn't matter if it got done at all, but grandma had something she could work on and she could feel like part of the support team. And mom could think of her as not part of the support team, just grandma. That was the relationship that she really wanted to have with her mother. And so I just want to sort of put that out there as a suggestion. If there's somebody who is burdening you with their help, it's okay to figure out ways to give them something else to do and to not personally consider them part of your core support team. I also want to be clear that sometimes support people need help. So if you are a caregiver for a child with a genetic condition, there are support groups for that. Maybe not for your specific genetic condition, but certainly for people who are caregivers for a child with a chronic illness. There are sibling support groups for the kids in the family who don't have a diagnosis, but who may be experiencing a lot of the stress that's happening in the family, kind of from the sidelines, and feeling like the attention is not on them. Family counseling can be helpful. There are a lot of family counseling resources for families that are dealing with a health condition in any family member. And you don't have to find a group that's specific to your diagnosis for it to be helpful, because there are a lot of issues that families deal with across different diagnoses that turn out to be the same. Financial issues, you know, guilt, stress, all of those kinds of things. All right, so I'm going to wind up with some ideas of where to look for support if you feel like you need to reach out and you'd like some resources that you don't already have. Or if you're a healthcare provider, I'm not sure who the audience will be for this talk. If you're trying to support your patients, here are some things that I have found useful. So when we're talking about EDS, one of the first resources I give to people is the EDS Society website. There are lots of online resources, both informational and emotional support. And they also have a lot of local affiliates, so specific in-person groups in a lot of places around the world, depending on what it is that you are looking for. Another organization that has some good information for families is NORD, the National Organization for Rare Disorders. And if you just do an online search for NORD, you will find their website. They've got information about financial things, about getting involved in advocacy, research, and they've also got some information about living with an undiagnosed rare disease. So for those folks who are sort of ending up, you know, in the EDS group because it seems like maybe it's EDS, but you don't have an official diagnosis, those kinds of situations can be stressful just in the unknown aspect. And so I would check out those resources at NORD, because there are a lot of people who are living with undiagnosed rare disease that fall, you know, sort of similar to this thing, but not this thing. And then of course, Facebook groups, other social media. I'm sure if you're on Facebook at all, you've probably looked for something that surrounds your diagnosis. There also are groups that aren't diagnosis specific. So if you are dealing with caregiver fatigue, those kinds of things, or if your child is dealing with joint pain, there are a lot of symptom-based support groups where people share ideas for what kinds of things have helped them. So it doesn't always have to be EDS in the title for a support resource to be useful. And then I encourage people, if you're a joiner, if you're somebody who likes to get involved in groups, to get involved in advocacy. There are lots of nonprofits that are working on these kinds of issues, including the EDS Society. And when you get involved, you meet other people who are also working around the same issues as you. I also encourage people to participate in research. You can meet really cool people that way as well. And all of the patients and families that I know who have done those kinds of things have really liked it. But it kind of depends on whether that's your thing or whether that would feel like a burden. So you have to make your own decisions about whether you think that would be helpful for you. It's also reasonable to ask your healthcare providers if they know of other patients who are dealing with rare diseases. Sometimes healthcare providers can reach out to other patients and say, hey, you know, I have these two families who both have, you know, a daughter who's 8 or 9 years old who are dealing with some sort of rare condition, even if it's not the same rare condition. Sometimes that's a great way to meet people who are local, who are in your neighborhood, who are dealing with similar things. We have certainly made connections for patients ourselves that way. with getting everybody's permission, of course, first for patient privacy reasons. And then finally, my last suggestion is that if you cannot find the group that you want, consider whether you're somebody who would want to start a group. It's a lot of work. I'm not suggesting that it's a simple thing to do. But if you're a person who thinks that would be a fun challenge to take on, you can really, really put together something amazing. So I will encourage you to think about that as an option, or find somebody in your support team who wants to start the group and wants to take on the administrative work of advertising and gathering patients and putting people together. And with that, I will say thank you so much for being here and for wanting to think about how do we support families with children who have a rare condition. And I hope that I will get to answer questions from some of you at the Q&A panel.